Decapsulation for nonsurgical nephritis. The effect of decapsulation upon the kidney. The disappearance of albuminuria after an operation performed for surgical disease of the kidney has been noted by various authors and is not a very uncommon experience. In 1901, Edibles, having observed these facts in a number of nephropexies, conceived the idea of aiding the return to normal of the kidney by stripping from it its fibrous capsule, on the theory that tension would thus be relieved and that the new capsule formed from the cellular tissue about the kidney might prove more vascular than the old and thus supply more blood to the kidney. Following out this theory, at first chiefly upon cases of albuminuria associated with nephrotosis, later upon all kinds of albuminurics, Edibles reported in 1903 51 cases, of which 14% died, 44% improved, and 14% were definitely cured. But in the meanwhile, Robson, by a series of careful investigations, demonstrated that bacterial nephritis, i.e. pyelonephritis, or nephritis causing renal pain or hematuria, could be cured by nephrotomy with decapsulation, but that true Bright's disease, nonsurgical nephritis, could not be so cured. Experiments upon dogs, rabbits, and cats have shown that the capsule of scar tissue formed after decapsulation, although more vascular at first, soon develops into a fibrous layer closely resembling the original capsule and is, if anything, more closely adherent to the kidney. Autopsy reports are few and conflicting, but in the main confirm this view. Elliott collected 112 reported decapsulations, among which 29 cases of nephrotosis with albuminuria operated upon by nephropexy with or without decapsulation. Almost all did well. His 76 cases of medical nephritis show 36 deaths, 14 unimproved, 26 improved, ? Unfortunately, most of the cases were last reported within 6 months after operation. Improvement for this brief space is doubtless due to the relief of congestion. Indeed, the benefit derived from decapsulation is apparently due solely to this relief of congestion, not to any permanent change in the blood supply. Edibles has operated upon 103 cases and observed the survivors for at least 15 months. Of these, 11 died as a result of operation, 29 more of chronic nephritis, and 10 more from other causes. Of the 53 survivors, Edibles estimates 11 as improved, 33 as cured. Edibles' definition of a cure is the absence of symptoms of nephritis and entirely normal urine for 6 months. That only 18 of these patients were, quote, cured within a year of the time of operation probably shows, contrary to Edibles' opinion, how independent of operation these so-called cures are. It is the consensus of opinion that decapsulation may be beneficial to the acutely congested kidney, whether the congestion be bacterial or toxic, but that it is of no service in chronic nephritis.